Hey, sorry for today class because just now I went to Lewang Korea. I thought that today we are going to have physical class. Fortunately, I went there. I only realized that our convo haven't finished yet. Okay, sorry, because I think the traffic is very congested. So even though it's quite near from Lewang Korea to here to my office, but I take more than 20 minutes to reach my office. So I'm apologize for today class. So without further ado, I will continue today class. Okay, today we are going to have more further discussions on the directic. So last week, still remember we have to finish two classes of directic drugs. Today we're going to further another four types, 4 or 5 types. So the first one we're going to study today is thiazide and thiazide-like directly. Basically, based on the words, sometimes you may misunderstanding. They share the similar structures. Actually, no, they have compound structures is quite different between thiazide and thiazide-like directly. Why they put thiazide-like? Because the mechanism of action is mimic thiazide. That's why they put it as a thiazide-like directly. Okay. So thiazide and thiazide-like diuretic are the largest group of diuretic. Means that they they their component is the group member is very lot in terms of numbers. So that's why they call it as the largest diuretic group. So can normally used to elevate the edema of any causes. They don't care. But the condition is they don't care whether it's a heart failure or renal disease. As long as you use this drug, able to cause diuresis. So normally clinicians use this drug is for mild and moderate hypertension because these two groups of drug going to reduce your plasma volume and also cause the relaxation of vascular small muscle. That's why able to use for hypertension management. So one more thing you need to remember is for hypertension actions require 4 to 6 weeks to establish, meaning that even though today you give the drug, uh, they show you the directed actions, meaning that you diuresis, but your blood pressure still not able to uh, reduce. Why? Because your body going to compensate the conditions and overcome the condition. That's why your blood pressure will remain until 4 to 6 weeks of continuous using this drug. Only you can see the antihypertensive effect. So, in another words, the hypertension actions of the drugs only show after 4 to 6 weeks of administration. Okay, clear? You have to bear in mind. They won't show you immediately. They will show you after 4 6 weeks. Okay. And then, but the diuretic action will begin immediately. It means that once you take, immediately you will see the diuresis effect. Okay. So, thiazide diuretics such as metronidazole normally will add to a loop diuretic regimen for heart failure, systolic dysfunctions. Okay. Uh, because they are the mechanism of actions, that's why they normally they were going to use the two diuretic in together. Okay, so to reduce the refractory reactions. Okay, refractory reaction means that resistant reactions. So there are few common types commonly used drugs what belongs to this group. They are chlorothiazide, chlorothiazidone, and metronidazole. So the mechanism of actions, okay, of course, before we go in detail, you should look at the figure in the right hand side. Okay, you nampak the cross sections. Okay, cross section means that the pathway that inhibited by this group of drugs. Okay, So there's few clauses here. The first clauses is occur in the between the basolateral site and your artery. Okay, meaning the intercellular. Okay, inhibit the absorption of sodium and also chloride as well. So the chloride will accumulate in your lumen, and lithium will also accumulate in lumen. So basically from here, then I think you get an idea what happened, what is the mechanism of actions. Actually, the mechanism of this drug is inhibiting the sodium transport. Makes sense. Sodium transport cannot able to go back to your bloodstream. So that's why inhibit the sodium aspect, sodium transport, especially in your distal tubule. Okay, here showing the distal tubule. Okay, this is the mechanism of actions. Okay, so another thing you need to remember is even though it belongs to this thiazide group, it's not similar. It's not belongs to the group that we studied last week. We call it as a carbonic anhydrase inhibitor. But this group we still have a very big carbonic anhydrase inhibition effect. So bear in mind. So from here you need until here, this group have two main mechanism. One is carbonic anhydrase inhibitions. It's an inhibitor for this enzyme, but the effect is very big. Second one is by inhibiting the sodium transportation, the second mechanism. Since just now I mentioned the weak carbonic anhydrase inhibitions, that's why do not cause acidosis, which is happen in the carbonic anhydrase inhibitor groups. So do not cause acidosis. Okay. Once you inhibit your sodium transportation, then you will cause chloride and potassium excretion, which is listed in the figure here. Okay. So as a result, you might have a hypochloremic, alkalosis, and hypokalemia. Okay. These are the two scenarios you might going to happen if you use this drug for long term. So why? Because they are not going to reabsorb these two ions. These two ions automatically we're going to excrete out. So that's why it may cause hypokalemia, alkalosis, and hypokalemia as well. So remember, so until now for this drug, few points you need to remember is do not cause acidosis, but will cause alkalosis because of hypochloremic effect. Why? Because first thing, they will inhibit the absorption of sodium. They enhance the excretions of chloride and potassium. Okay. So another thing is they are not refractory. Not refractory means that will not create insensitivity or resistance. Refractory means that create a resistance. But even though the alkalosis conditions might happen, because the alkalosis is a normal scenario when you use this drug. Even though you develop alkalosis, but still cannot show the resistance of this drug. Means that the drug still able to use even though showing the alkalosis conditions. Okay. Okay. Another thing is for elders, if you use this drug, might cause hyponatremia. Okay. In patients, so you need to remember because they inhibit the absorption of sodium. Okay. Another thing is this diuretic drugs reduce the renal excretions of iron, meaning that iron will preserve in your bloodstream. So some patients may show mild elevations in serum calcium when you use it for long term. So the definitions for chronic is more than 3 months we consider as chronic. Okay, I repeat again. More than 3 months of usage we only consider as chronic therapy. Okay, less than 3 months we cannot consider as chronic. The definition is like that, so you need to accept. Okay, since calcium is important for us. That's why reabsorption of calcium sometimes may bring some benefit to the patient. Okay, benefit to the patients. So that's why they call it as bone saving effect, especially for those osteoporosis. Okay, clear? So from this slide, we can summarize a few important points here. The first important point is do not cause acidosis because they are weak carbonic anhydrase inhibitor. Second one, the main mechanism is inhibit sodium transport. Okay, and then enhance chloride potassium excretion. Because of enhanced sodium potassium excretion may cause hypochloremic alkalosis and hypokalemia as well. Because you excrete these two components out from your body, isn't it? So another beauty of this drug is might not cause refractory. Even though alkalosis happens, might also not cause refractory. So another advantage of this drug is may reduce the excretions of calcium from your urine. So that's why sometimes we call it as bone saving effect. Fine. Now we go to side effect. So every drugs they have side effect, whether it's serious or not. So the main side effect is they're going to reduce your water. Then inhibit the sodium absorption may also inhibit the amount or reduce the amount of sodium in your body, especially your plasma volume. That's why your blood pressure may going to drop. So once your pressure will going to drop, then you might have orthostatic hypotension. Well, what is the meaning of orthostatic hypotension? This one always happen in elders. When they take antihypertensive drug, they sit down, so they feel okay. When they quickly change their position from sitting and then become standing quickly, so they might have this orthostatic hypotension, meaning that blood pressure drop dramatically. Okay, due to the changes of positions. That's why we call it orthostatic hypotension. You may ask me whether this one important or not. Yes, this is quite important because of a lot of elders fall down and then pass away because of orthostatic hypotension, especially after they wake up, they want to go to toilet, they immediately stand up and then go to toilet and then fall down in toilet because of orthostatic hypotension. Okay, once the blood drop, even though few seconds only, 1 or 2 seconds only, but they cannot stand properly and then they will fall down and knock their head. And at the end you have no hemorrhage. This one always happen. So remember those if let's say your house, your home got elders, ask them when want to change position, please be slowly. Okay. So that's why another side effect is might cause hypokalemia, hyperuricemia, and also hyperglycemia as well. Okay. Hyperglycemia means that your blood glucose will going to increase. Hyperuricemia means that your uric acid going to increase in your blood. And then hypokalemia, just I mentioned, isn't it? We're going to excrete out the potassium. That's why hypokalemia. So why hypoglycemia? Because the drugs are able to decrease your glucose utilizations. Okay, that's why will upset your glucose level, especially those are diabetic. Bear in mind, those are diabetic. Means that previously, before you use this drug, maybe your blood glucose able to control very well. Once you use this drug for a certain period, then you found that your glucose might not be able to control. Okay, elevate a little bit because the conditions, the effects come from the drugs. Once you stop, automatically, of course, the drug, the effect will going back. The normal condition will going back. So sometimes it also cause sponge and cramp your muscle because of imbalance of electrolyte. Okay, and then short-term thiazide diuretic therapy can cause elevate of total cholesterol level and especially LDL. Later, we're going to study the classes of cholesterol, and then in detail doesn't matter. Don't worry. So you just remember may cause elevate of your LDL and triglyceride as well in a dose depending manner. Once you saw the dose depending manner means that definitely due to the drugs, because once you increase the concentration of the drugs amount for the patient, the dosage of for the patient, then you will see the more obvious effect. Definitely from there you can draw a conclusion. Definitely the effect is from the drugs, not other factors. So that's why we dose responding method is very important for pharmacological study. Okay, let's say you do the treatment, you use 1 gram, 2 gram, 3 gram. At the end, you found that all the 3 treatments, 3 doses show you the similar effect, meaning that it's not dose responding. Then something might happen, something wrong might happen. So in normal conditions, normal approach, pharmacology effect normally is in the dose depending manner. Okay, clear? So why may cause cholesterol? Because due to the decrease of or reduce the volume, especially your plasma volume, because of diuresis, you excrete out a lot of water, then automatically your plasma volume will going to reduce. Then by doing so, will stimulate your systematic nervous system and renin, angiotensin, aldosterone, RAA system. Well, once you activate these two systems, they will cause the changes of your cholesterol. That's why you may see the cholesterol level increase after you use the drugs. So even though majority of the drugs might cause increase in high cholesterol, but some of them might not show increase in cholesterol as well. So I give you one example. Indapamide has no been shown to affect your cholesterol and lipoprotein profile in long-term or short-term therapy. This is quite interesting. Why didn't cause effect on cholesterol? Even though just now we mentioned that isn't it the cholesterol level is mostly related to the changes of plasma volume. So it doesn't matter, we don't go and bother because this one we pass to scientists to study more. Okay, what happened? For me, I fear that not only because of plasma volume, might be other activation involvement of pathway as well. So it doesn't matter lah. Since we are not going to focus on that push. So don't worry. So as long as you know that even there's a one and one example of drugs that will not cause cholesterol and profile changes. Okay, clear? Clear. Then we go to another effect. Even though this indapamide is not going to affect the cholesterol, but they will cause another side effect which is called as hypertensive reactions, skin rashes. If you if me, I'm not going to prescribe this drug. Okay, because based on correct, if you need to compensate lah, which one is more important? Hypersensitivity reaction is more important than cholesterol level. Cholesterol level sometimes you can use alternative treatment or complementary treatment to reduce or to control. But the hypersensitivity once happen, sometimes might be stay there, meaning that sometimes might be become permanent. So for me, I wouldn't sacrifice cholesterol for hypersensitive reactions. I will look more on hypertensive reaction rather than cholesterol. Okay. So okay, this one also might cause diarrhea, constipations, headache, impotence. Remember importance. That one is important for man or human life. Elevate of blood urea, nitrogens, and serum creatinine means that they're going to affect your kidney functions. Okay. That's why I say no. not always good if you use this drug, just because you want to prevent the cholesterol level to increase. Okay, clear? That's why you realize or not, once a new drugs introduced into the market, then not always the drug is better than the old versions one. Even though mostly it's better than old version, but in real conditions, not always better than old versions. Why not better than old versions can still introduce to market? Because they already invest billions of ringgit, not billions of USD. So once they invest billion, no matter how they want to take back the money, that's why they will introduce to market until withdraw from market. Once withdraw from market, then at least they will cover their costs already, isn't it? That's why sometimes I'm not agree with their approach. So these are the thiazide group and thiazide-like diuretic group. Okay, their classifications is based on the durations. Which one is longer time better? The effect is okay. So another types of diuretic, we call it organic acid, or sometimes also called as a loop diuretic. Why loop diuretic? Because they are focused on Henry loop. Okay. Normally we use for those who resistant towards thiazide diuretic. It's an alternative drugs for thiazide diuretics. And the greatest diuretic action compared to other, this one is the greatest. Okay, especially compared to thiazide, the effect is better than thiazide. That's why the effect is better than that used for severe peripheral edema, pulmonary edema. Okay, your lungs, pulmonary edema is quite important, and then peripheral edema. If you based on these two conditions, one is more serious, of course, pulmonary, because you cannot breathe. Cannot breathe. That's why it's important. The patient who have pulmonary edema is very torture. They cannot lay down when they want to sleep. Once they lay down, the water will going to compress. They cannot breathe. They have to sit. Sit if they want to sleep. Okay. Sitting position, they need to change their position instead of lay down and then become sitting positions. Okay. Otherwise, okay, may also use for those who have edema, which is associated with chronic heart failure, liver cirrhosis, renal disease as well. Okay. So another example of this organic acid is anthraquinic acid. Is used for long-term management of acids. Acids is accumulate of water in your stomach cavity, your stomach, due to malignancy and lymphedema. Lymphedema means that your lymph is edema. Okay, edema and then cause the acids. Okay, normally the malignancy is referred to liver, malignancy referred to liver cancer. So one of the most obvious symptom for signs symptom for liver cancer when they reach the end stage is acids, accumulate of water in the stomach. So you may ask me whether we can do surgery to remove the water from the stomach cavity or not. Can, but not so frequent. It's only two times or 3 times maximum. Okay, you can insert the tube to withdraw the blood. Not withdraw the blood, withdraw the water from your stomach, but only takes you only can perform this surgery for 2 or 3 times, not more than that. Because why? Of course, not once, 2 or 3 times, and the patient already passed away. Passed away. So the mechanism of action is inhibit sodium chloride ion transport in your loop of entry. So of course, before we go further, then we nice to have a look on the member of this group. Okay, we have bumetamide, anthraquinic acid, furosemide, torsemide, and others as well. Okay. So the mechanism is straightforward. They inhibit the sodium chloride ion transport in your loop of Henry. So that's why may cause sodium chloride and water loss. Tremendous, means a lot. Then this diuresis condition may come together with hypochloremic alkalosis straight away. Okay, this way I think you're familiar, isn't it? So just now still remember thiazide group, thiazide group and thiazide group. They also might cause hypochloremic alkalosis. So they are not refractory, even though the base acid changes have occur, meaning that the base and acid changes occur, meaning that the sodium chloride is lost, but the effect is still remain there. Because why? Because the urine flow, your urine is always flow, then the condition might be replaced by, the scenario might be replaced by new your urine. Okay, urine. So that's why they will not cause a refractory. So hypokalemia might also happen. Okay. So normally, this is not uncommon for furacid or antacid, anthraquinic acid together with metalazone. So if you use two different groups of diuretic, normally you will see hypokalemia. This is a sentence try to tell you hypokalemia is a normal condition if you use different group of drugs together, especially one is from organic acid, one is from thiazide group. Okay, it will always show you hypokalemia. So another thing is in certain conditions like anthraquinic acid and furosemide, sometimes may also cause refractory. Okay, refractory. If you use with metalazone and chlorothiazide as well, you use two drugs that might cause refractory. Because why? The drugs are highly bound to the plasma protein. Okay, we back to the second point. The second point we do discuss, we say that this organic acid might not cause a refractory if we use it alone. If let's say we use it with other drugs might cause refractory because of the main reason is the occupations of the drugs with plasma proteins is different. Occupied means that the plasma, if let's say you use two types of drugs together, the ability of the drugs combined with plasma protein might be different. One might be as a competitor with another one. So if you took these drugs together, sometimes may cause a competency. So that's why might lost the activity. The activity is mainly due to the bonding of plasma protein, the ability of bonding on or to plasma protein. Okay, clear? So that's why certain drugs will bond tightly will not excrete out. Certain drugs that are not bond tightly we are going to excrete out in more than compared to the others. Okay, another concern is, for example, A drug will bond with plasma protein, B drug will not bond with plasma protein with the presence of A drug. That's why A drug might stay longer time in your body compared to B drugs because of A drugs is occupied the uh, plasma protein. Okay, yeah. So okay, like others, diuretic drug, this drug might also cause some side effect. So the obvious side effects are hypokalemia, hypoglycemia, and hypoglycemia, as we discussed previously. Okay. So in this condition, the hyperglycemia might be due to insulin secretion. Reduce of insulin secretion means that this drug may be going to inhibit your insulin secretion from your pancreas. So might cause autotoxicity, meaning that we call deafness in some patients. If you use this drug with aminoglycoside, still remember antibiotic, okay, such as amikacin, kanamycin, neomycin, streptomycin. The toxic effect of this aminoglycoside we're going to increase, and cause autotoxicity. So the lobe directly have a special condition, because this one no need to understand. That's why from here you need to, they want to highlight here is you need to observe the patient's condition time by time in order to prevent any unwanted side effect. So another group of antidiuretic we're going to study is potassium sparing diuretic. So the member is amylolide, yeah, spironolactone, triamterlin, triamterlin. Okay, basically they will inhibit the hypokalemia, which is almost happen in all the diuretic which we have studied before, isn't it? So this one might have inhibit hypokalemia, means that they will conserve the potassium. Okay, this is often used. This drug often used to control the potassium depletion. Okay, from potassium depletion. Potassium depletion. So for hypertension require long life treatment. That's why we need to use thiazide or thiazide like that diuretic and potassium sparing drug together to avoid the hypokalemia effect. Okay, clear? So the mechanism of action is, even though they are from same group, some of them might have different mechanism of action. So even though different, but mostly all of them are inhibit your potassium secretion. But spironolactone might have another extra benefit, is they were going to block the aldosterone receptor. By doing so, you're going to inhibit the sodium secretions, sodium transportation, and control the potassium secretion. Why, even though this spironolactone is blocking the aldosterone, but sometimes we cannot consider as a aldosterone antagonist. Okay, for other drugs. What I mean is spironolactone might have activity against aldosterone receptor, but are not all, like amylolide, triamterlin, might not have this ability to block the aldosterone receptor. Okay, that's why only these two drugs only able to inhibit the or alter the conditions of the membrane, especially in distal convolution tubule. So to inhibit or to alter the potassium secretion. So by looking at these 2 points, even though they are belongs to same group, but they roughly they have different mechanism of action. Okay, the side effect is quite similar with others. The only difference is might cause gynecomastia, especially in men. This gynecomastia happen in women, I think it's okay. What is gynecomastia? Gynecomastia is enlarged of your breast. So if you are male, you're going, if let's say you use this drug, then these are the common side effects. Means that your breast is getting bigger and bigger. But until certain extent only, okay? Impossible for A cup change to C cup. Okay, we need to remember this one. This is common conditions. So those who have impair of renal functions and diabetic, hyperkalemia might always happen. So if let's say you want to use potassium supplement to control the hypokalemia, then try to try to think twice, because this may also worse your condition, which is may double in the increase of potassium condition amount in your bloodstream. And another thing is that this drug seldom administered alone. They will administer with others. Okay. Okay. They give you another scenario lah. If let's say labor, if this drug used alone, might cause 10% of the patient to have hypokalemia. Hyperkalemia. If you use this drug with thiazide or others diuretic drugs, then the possibility for hyperkalemia might decrease until 1 to 2%. Okay, meaning that if you use this drug alone, normally they will cause hyperkalemia. If you use the drug with others, the possibility might be reduced. Okay, so that study, they saw that tumor development in long term of high dose in animal study. What type of tumor they didn't mention, okay, especially for spironolactone. So betamycin, they related to tumor. So whether suitable for those cancer patient or not, so far there's no clearance, clear information about this one, but they just ask you to take precaution because they found that this high dose of spironolactone might cause cancer, might cause development of tumor in animal study. So I think I stop here. Then we continue tomorrow. Tomorrow still online or physical
Tomorrow
class?
face to face, doctor.
Huh?
Face to face.
Face to face. Okay. Okay. See you tomorrow or see you afternoon. Afternoon we're going to have a physical class, isn't it, for practical. So you go and you afternoon go and take your lunch first. Bye bye.
Okay, thank you, doctor.